I've seen where yams are being grown in sacks. Yes. Even if you don't have a space, you don't need too much space to do that. Male involvement is key because if a man doesn't have this knowledge of all this, he can't encourage or support the family to do that.
Hey there, I'm Dr. Song Webu. Welcome to the Purple Diaries podcast, the Policy Innovation Center's advocacy platform where we talk about all things gender and social inclusion. Great news! The Gender and Inclusion Summit 2026 is coming, and this year's theme is Making Innovations Count for the Last Mile. I had the opportunity to sit down with some amazing change makers and talk about what they're doing to make innovation count for the grassroots people, the ordinary Nigerian on the streets. Join us in season 2 of the Purple Diaries. You don't want to miss it. Good morning and a warm welcome to the Policy Innovation Center's Purple Diaries podcast. So, to start with, can you please introduce yourself to our audience?
Good afternoon. I'm happy to be here. My name is Victoria Agomo. I'm the Senior Program Officer, Child Survival at Nutrition International. In my role as a Senior Program Officer, I plan and implement high-impact child health and nutrition interventions with Nutrition International. I'm happy to be here and looking forward to a good discuss.
You're very welcome,
Thank you.
Victoria. So, to start off, my very first question is Nutrition International is doing a lot of great work helping pregnant women and young children in Nigeria get the nutrition they need. Can you talk about, particularly in the rural areas, what this work is and what it's like?
Yeah, so for us at Nutrition International, we support the state government at federal level, state level, and local government levels to deliver high impact, cost effective nutrition and child health interventions. And these interventions cut across vitamin A supplementation for children 6 to 59 months, provision of maternal MMS, multiple micronutrient supplementation for pregnant women, and iron folic acid as well. And we also support the state governments where we work to ensure that children with diarrhea are treated with zinc and low ORS across communities where we work.
So very, very important life support and life preserving work. Thank you. So what kind of innovative approaches do you leverage to make sure that your programs and interventions reach the right people at the right time?
So thank you very much for the question again. So for us at Nutrition International, we use data-driven planning and micro-planning to ensure that all the hard-to-reach populations, children wherever they are. So we ensure that no child...
Sorry to interrupt, because I don't want to assume that everybody in our audience understands what you mean by micro-planning. That's a technical term.
Yeah.
So what do you mean by micro-planning?
So micro-plan, in a layman's word, we say a small plan.
Okay.
So that plan constitutes the settlements in a community, the local government. It shows us exactly where these women and the children are, so that we use that population data to figure out where these mothers and the children are and what health facilities are available and close to them, where they can access services when especially during maternal, newborn, and child health weeks. So that maternal, newborn, and child health week is a biannual campaign supported by the federal government of Nigeria and trickled down to the state government. So it's a biannual intervention or a campaign, biannual campaign, whereby mothers of children 6 to 59 months, pregnant women, come to the health facilities to assess commodities available to them. So at Nutrition International, we use that approach to ensure that we reach these children wherever they are incorporating hard-to-reach communities. We also build capacity of health workers to ensure that they have the knowledge, the skill, and the know-how to implement these activities. Not only asking women to access care, we also make sure that those commodities are available to them, because it's
Very
one thing
important, yeah.
coming to the health facility, and when you get to the health facility, those commodities are not available.
there,
So at Nutrition International, we work with the federal, state, and local government to ensure that these commodities are available and accessible to the children and the mothers that need them most.
And I love what you said about your interventions being based on data, data driven, evidence driven. So they're not just arbitrary, right?
Yeah.
In your experience, right, what has worked best? I know you talked about the campaign just while you were speaking, but outside of the campaign, for example, the one you talked about that is, supported by the federal government, what has worked best in terms of improving nutrition for women and children in Nigeria, especially people in underserved rural areas?
So for me, what has worked best in improving maternal and child health is the strong government leadership and ownership.
Very
Right.
important.
Yeah. So it's very, very important because the government own it. It's our program. The children are us. The women are our mothers. They are our wives, So that strong commitment from the government, the enabling environment that they give all the partners to implement across communities has really worked out. So it shows that the governments are willing to listen to the plea or to the plight of the populace, ensuring there's an enabling environment. The health facilities are available. Health workers are being trained to deliver such services. And the health facilities are always open 24 hours, 7 days for mothers and children to access care.
Wow. Okay. So very important points made. And I love how you put it, because a lot of the time people tend to, yes, we know that government support is necessary, but we don't understand how. But the way you put it, the children are ours, the mothers are also our mothers, right?
Yeah.
And so then it just makes sense that the government should be interested. And 24/7 service, that is impressive. Even in the rural areas?
Yes.
Wow.
Yeah, we have some flagship LGAs, not all LGAs though.
Okay.
So under the PHC under one roof.
Okay.
So there's a flagship health facility, maybe one per ward, per local government that operates 24 hours. Even at midnight, a woman can be in labor at midnight and she is attended to.
That's lovely. And then hopefully, I guess the hope would be that from there they should then extend
to other LGs
awesome.
and wards in the LGs.
So moving on to my last question, I promise, and it's very near and dear to my heart. So I know that in the recent past there has been a lot of emphasis on ready to use foods, especially managing severe malnutrition and that sort of thing. But we understand that those things are supposed to be like a temporary stopgap, right? You can't leave a child on that permanently, because the hope is that they would come back from the malnutrition.
Or they will relapse and come back again.
Do you understand? So looking forward to like a more sustainable long-term measure, right? How can our own local foods, right, here in Nigeria, and community efforts be better used to improve nutrition for mothers and their children, so that we don't keep cycling and relapsing from malnutrition, severe malnutrition, moderate malnutrition, and back again? And we know that, if we meet a child in severe malnutrition and we bring them out of it, we are sure that the next time we see this child, they're on the straight and narrow.
So locally available foods are affordable because we have them, we grow them, we farm them. So these locally available foods, they are available, they are culturally sensitive, it's not something one can go to a far place. So it's just within us.
And more acceptable.
And more acceptable. So it's very, this locally available food is a sure way of combating malnutrition. So for us, or for me, I would say our mothers are being equipped or trained to own a backyard garden, a home garden, so that these crops are something they can easily grow. You don't need a big farmland to do that. When you have a backyard garden, you just make sure you incorporate all the food groups, like feeding the child immediately after breastfeeding. So we advocate for exclusive breastfeeding from 0 to 6 months. And when a child gets to 6 months, we know that breast milk alone is no longer enough, to meet that child's nutritional needs. So what do? We give complement. We have to complement with the breast milk, because the breast milk will still go on, but you need to add something else to it to ensure that that child lives a healthy life. So in doing that, we have food groups that mothers can be taught on how to make this nutritious food for themselves and for the and even for the family and for the young children. They would incorporate egg, vegetables, green leafy vegetables, legumes, grains. We have up to 8 food groups for a child, and we advocate for at least 5 out of 8. So the mother should be able, or should have the knowledge to incorporate these 5 out of 8 food groups to ensure that at least minimum meal minimum dietary diversity. So the mother makes sure that 5 out of 8 food groups are incorporated in the food. The women learn this home gardening, ensure that this food, because with the home gardening, it will make sure that they have this food grown all year round. So from year to year, and they are not dependent on the market.
And I like that you said, I actually love this idea, right?
Yeah.
But then I can already hear some people in our audience saying, I don't have a garden in my backyard.
Yes, but you have.
I live in Lagos.
Yes, you live in Lagos.
All I have is my veranda.
Yes, you have your veranda. You have a broken bucket. You have a broken bucket that you can, instead of throwing them away, you fix them, add your manure to it. You use it to grow your vegetables or whatever you want to grow. I've seen where yams are being grown in sacks. Yes, yams are being grown in sacks. So you can use this cement sack bags. You use tire, like old tires. You use tires, and even if you don't have a space, just like I'm saying, you don't need too much space to do that.
Yeah.
If you have a bucket that you can put your manure, you put your grains and
that
all
that one I tried.
Yeah.
I tried, so I'm a witness. I know it's possible. Like
so
this
it's
ugu
possible.
here
Ugu hairs and leaves there and all that. So by the time a mother does that, you see, you don't need a big farm to do that. And as well, we involve the men.
Yes.
Male involvement is key to combating, because if a man, a head of the household, doesn't have this knowledge of all this, he can't encourage or support the family to do that. So male involvement is very, very important in actualizing this.
Thank you so very much. This has been enlightening. I actually like the part about, because a lot of the time when we talk about rural women, right, we also tend to forget, like in cities like Lagos, there are women who are facing the same problems, right, but they don't have that space, the luxury of space like rural women would. So this is very encouraging.
Yeah, so you don't really need much space if you want to practice your backyard or home gardening. Your veranda is enough for you. If you have a broken bucket, you have a sack bag, you have a cement bag, it's just for you to get your manure, you keep it in the corner, put your soil in it, and then
beans,
throw your
whatever in there.
Yes, and you start reaping the fruits of your labor.
Yeah. Thank you so much for the work you do. It's very important. And I love the emphasis on men being active players in this thing as well.
Thank you very much for having me.
It's been a pleasure.
Yes, thank you so much.